Did you know that more than 800,000 people experience a heart attack every year in the United States? That's already a staggering number. But here's something even more surprising. Everyday medications you take might actually be putting your heart at risk without you even knowing it. Pain relievers, antidepressants, and other common drugs have been linked to heart problems in research. In today's video, we're going to uncover 8 medications backed by science that could be quietly damaging your heart and share tips on how to protect yourself. Let's jump right in. NSAIDs, like ibuprofen, Advil, Motrin, and naproxen are some of the most commonly used pain relievers for things like headaches, inflammation, and fever. But here's the catch. Using them, even for a short time, could increase your risk of heart attack. A study from 2017, published in the British Medical Journal, showed that taking NSAIDs for just a week could boost your heart attack risk by 20 to 50%, depending on the dose. So how does this happen? NSAIDs interfere with prostaglandins, substances in the body that help regulate blood vessel function. This can lead to issues like fluid buildup, higher blood pressure, and narrower arteries, all of which put extra strain on your heart. Over time, that strain can lead to blood clots, which may trigger a heart attack or stroke. The danger is even higher for people with existing heart problems, high blood pressure, or a history of heart disease. Even if you're generally healthy, it's wise to be cautious with frequent use of NSAIDs. To stay safe, stick to the lowest dose possible and use them for the shortest time needed. If you're looking for alternatives, acetaminophen, Tylenol, physical therapy, or anti-inflammatory foods like turmeric and ginger can help. And of course, always check with your doctor before using NSAIDs for an extended period. Antidepressants, particularly SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors, are commonly prescribed to treat depression and anxiety. Medications like fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro, fall under the SSRI category, while venlafaxine, Effexor, and duloxetine, Cymbalta, are SNRIs. These drugs work by boosting serotonin and norepinephrine levels in the brain, which helps improve mood and emotional balance. However, research has shown that SSRIs and SNRIs might increase the risk of heart problems, especially for people with existing heart conditions. A 2018 study published in JAMA Psychiatry revealed that SSRIs could lead to abnormal heart rhythms, higher blood pressure, and even blood clot formation. Plus, these medications can interfere with blood clotting by reducing platelet aggregation, which may raise the risk of bleeding complications like hemorrhagic stroke. The risk is even greater for older adults or those with a history of heart disease or stroke. While the benefits of these medications are often significant, it's important to exercise caution. If you have heart issues, consider discussing alternative treatments with your doctor, such as cognitive behavioral therapy, CBT, lifestyle changes, or exercise, which can naturally help boost serotonin levels. And remember, never stop taking antidepressants suddenly. Always work with your doctor to taper off gradually. Calcium channel blockers, CCBs, are commonly prescribed to manage high blood pressure, chest pain, angina, and certain heart rhythm disorders. Medications like amlodipine, Norvasc, diltiazem, and verapamil fall under this category. These drugs help relax blood vessels and reduce the heart's workload, which in turn lowers blood pressure. However, research has shown that some calcium channel blockers, especially when taken in high doses or for a long period, can actually increase the risk of heart attack and heart failure. A study published in Circulation found that certain short-acting CCBs were linked to a 25% higher risk of heart attack in some patients. These medications can also cause fluid retention, which worsens heart failure, and may lead to low blood pressure, resulting in dizziness or fainting. In some cases, CCBs can interfere with the heart's rhythm, increasing the risk of arrhythmia in certain individuals. If you have heart disease, low blood pressure, or a history of heart failure, it's especially important to be cautious with these medications. If you're on a calcium channel blocker, keep an eye out for side effects like swelling, dizziness, or an irregular heartbeat. Be sure to talk with your doctor about whether other blood pressure medications, such as ACE inhibitors or beta blockers, might be safer alternatives for you. Certain diabetes medications, especially older ones in the thiazolidine-dione (TZD) class, have been linked to an increased risk of heart attacks and other heart-related problems. A prime example is rosiglitazone, Avandia, which was once commonly prescribed to manage blood sugar levels in people with type 2 diabetes. However, a groundbreaking 2007 study published in the New England Journal of Medicine found that rosiglitazone raised the risk of heart attacks by 43% and the risk of cardiovascular death by 64%. As a result, the FDA placed restrictions on its use in 2010, though some of these restrictions were later relaxed. So what makes these medications risky for the heart? TZDs can cause fluid retention, which leads to swelling, higher blood pressure, and increased strain on the heart. Over time, this can worsen heart failure or trigger serious cardiac events, particularly in high-risk individuals. If you're taking rosiglitazone or another high-risk diabetes medication, it's important to discuss safer alternatives with your doctor. Medications like metformin, SGLT2 inhibitors, and GLP-1 receptor agonists have been shown to be safer for the heart. Additionally, making lifestyle changes, such as eating a balanced diet and exercising regularly, can help manage blood sugar levels while lowering your risk for heart problems. Decongestants like pseudoephedrine and phenylephrine are commonly found in over-the-counter cold and flu medicines. They work by narrowing blood vessels in the nasal passages, reducing swelling, and making it easier to breathe. However, these benefits can come with serious risks for your heart health. Both pseudoephedrine and phenylephrine can raise blood pressure and heart rate, which puts extra strain on your cardiovascular system. A study published in the American Journal of Medicine showed that using pseudoephedrine can significantly increase blood pressure and the risk of heart attacks, particularly in people with hypertension, heart disease, or a history of stroke. These medications can also trigger irregular heart rhythms, leading to chest pain or palpitations in some individuals. The risks are even higher for those who drink caffeine, smoke, or take other medications that affect blood pressure. In rare cases, overusing decongestants has been linked to sudden cardiac events, especially in those with existing heart conditions. If you have high blood pressure or heart disease, it's a good idea to steer clear of decongestants. Instead, try natural remedies like steam inhalation, saline nasal sprays, or antihistamines if allergies are the cause. Always read the labels carefully and talk to your doctor before using these medications. Chemotherapy is a life-saving treatment for cancer, but some of the drugs used in the process can have harmful effects on the heart. Certain chemotherapy medications, particularly anthracyclines like doxorubicin, adriamycin, and fluorouracil 5-FU, are known to cause cardiotoxicity, which weakens the heart muscle and increases the risk of heart attacks. A study published in JAMA Cardio-Oncology found that doxorubicin can cause heart failure in up to 26% of patients, especially when used in high doses or over long periods. This drug damages heart cells by producing free radicals, which lead to inflammation and scarring in the heart tissue. Fluorouracil, often used for colon and breast cancer, has also been linked to coronary artery spasms, which can reduce blood flow and trigger heart attacks. Patients receiving chemotherapy may experience symptoms like shortness of breath, chest pain, or irregular heartbeats, which could signal strain on the heart. The risk is even higher for those with existing heart conditions or high blood pressure. If you're undergoing chemotherapy, your doctor might conduct regular heart function tests, such as echocardiograms, to check for any damage. In some cases, medications like dexrazoxane can help protect the heart. Staying active, eating a healthy diet, and avoiding smoking can also help reduce heart-related risks during cancer treatment. Testosterone therapy and anabolic steroids are often used to boost muscle growth, improve athletic performance, or treat low testosterone levels. While these substances can enhance strength and energy, they come with significant risks to heart health. A 2017 study published in JAMA Internal Medicine revealed that men who started testosterone therapy had a 30% higher risk of heart attacks and strokes within the first 3 months. Both testosterone and anabolic steroids can raise red blood cell counts, which thickens the blood and increases the risk of blood clots, high blood pressure, and heart attacks. They also lower HDL, good cholesterol, and raise LDL, bad cholesterol, which can contribute to blocked arteries. Anabolic steroids, often misused by bodybuilders, pose an even greater threat. Studies show that steroids can lead to left ventricular hypertrophy, where the heart's walls thicken, making it harder for the heart to pump blood properly. Long-term steroid use has even been linked to sudden cardiac death, even in young athletes. If you're considering testosterone therapy, make sure it's prescribed by a doctor and monitored with regular blood tests. It's best to avoid anabolic steroids entirely. Instead, focus on natural ways to boost testosterone, like strength training, eating healthy fats, and getting enough sleep. Proton pump inhibitors, PPIs like omeprazole, esomeprazole, Nexium, and lansoprazole, Prevacid, are commonly used to treat acid reflux, GERD, and ulcers by reducing stomach acid. While these medications are effective, long-term use has been linked to an increased risk of heart attacks and other heart-related issues. A Stanford University study that analyzed the medical records of over 3 million people found that PPI users had a 16 to 21% higher risk of heart attacks even in people without a history of heart disease. The suspected reason behind this is that PPIs may reduce nitric oxide production, which helps keep blood vessels flexible and open. Over time, this can lead to stiffer arteries, higher blood pressure, and a greater risk of blood clots, all of which contribute to heart attacks. Additionally, PPIs have been linked to magnesium deficiencies, which can cause irregular heart rhythms, arrhythmias, and muscle weakness. The risk is especially high for those using PPIs for months or even years. It's a good idea to use PPIs only when necessary and to explore safer alternatives like H2 blockers, such as famotidine, dietary changes, or natural remedies like ginger, aloe vera, and probiotics. If you need long-term treatment for acid reflux, talk to your doctor about heart-friendly options. Your health is in your hands. While some of these medications can be life-saving, it's crucial to be aware of their potential risks, especially when it comes to your heart. Always consult your doctor before starting or stopping any medication, and look for safer alternatives when possible. If you found this video helpful, give it a thumbs up and share it with others who could benefit from this information. Don't forget to subscribe for more science-backed health tips. Stay informed, stay healthy, and take care.